copy of his statement and its comprehensive nature. Mr. Speaker, I'd like to start by associating myself with the comments made by the Secretary of State, commending all those who are working to fight this outbreak, and in honouring Dr. Richard Kibung, who was killed last month, and joining him in expressing our deepest sympathies to all those who have lost their lives to the latest Ebola outbreak in the DRC. The death toll currently exceeds 1,000 people, and as the number of confirmed cases continues to rise, this deadly and cruel virus is certain to claim more lives in the days and weeks to come. The World Health Organization has said that it is unlikely that the virus will be contained, meaning its spread into neighbouring countries is not only possible but likely. This assessment from the WHO means that the world must act fast to prevent catastrophic outcomes, given the speed with which Ebola can contaminate and kill. David Miliband, who has recently visited the region, confirmed that the Ebola outbreak is getting worse, not better, and that this is happening despite a proven vaccine and treatment. Through DFID, the UK is already playing our role in this response and making a difference on the ground, and indeed as they have done in previous outbreaks. And real credit is due to DFID staff and all responders for their tireless work and commitment. And I'm pleased to hear the Secretary of State is discussing further action that DFID can take with other donor countries. Every day is crucial, and getting the response right is imperative. It is not simply a matter of issuing more money or resources, but giving the complex security context that the Secretary of State has laid out, a more hands-on approach and strategic nature is urgently needed. It has been widely reported that one of the major barriers to delivering the necessary response is the breakdown of trust between the affected community and those trying to lead the response. A quarter of people in the region believe the Ebola virus doesn't exist, and a third think it was fabricated for financial gain. Foreigners have been accused of bringing Ebola to DRC, and armed groups have stormed health centres and killed staff members. Medical humanitarian agencies such as MSF, who have the expertise and experience to fight Ebola, are being forced to suspend activities in the face of threats of further violent attacks. And as a result, people are left untreated, vaccines are not administered, and the majority of Ebola-related deaths are now occurring within the community rather than within health clinics. Lack of infection control and safe burials only speeds up the spread of the virus. In April, the country recorded its highest number of cases since the outbreak began, and we can expect this month's caseload to be higher than that. Transmission is occurring in highly populated areas where health systems are weak and hundreds of armed groups operate. So can I ask the Secretary of State what specific steps he is taking to ensure that all agencies prioritise working with the Congolese community in their response, and what urgent steps he is taking to gain the trust of the Congolese community? And can he tell us more about his discussions on supporting efforts to stop the current rumour mill of misinformation and secure negotiated access to the affected population? And what more he can do to reduce the problematic dependence on armed escorts and military involvement in the implementation of humanitarian activities. Agencies active on the ground report a major difficulty being that actors involved in the Ebola response are the very same actors that have played a long-standing role in the ongoing conflict in the region. So can he give assurances that he will uphold the principles laid out in the Interagency Standing Committee guidelines that state military civil defence assets should only ever be employed by humanitarian agencies as a last resort? And crucially, while we want to see everything done to get this emergency situation under control, will the Secretary of State agree that prevention is better than emergency response, and that we must provide the long-term support that will ensure DRC can build appropriate public health systems for the future? Thank you.
Secretary of State.
I'd like to thank the the Honourable Member for his, I think, moving, well-informed statement, which is clearly very well-informed by some of the actors on the ground. Just to reply to two of those questions, specifically, Mr. Speaker. In terms of stepping up coordination, there is an Assistant Secretary-General of the UN who is now operating out of Batembo, who has a broader coordination role for the different UN agencies. We've reached out to opposition leaders who yesterday made the first in a series of statements to communities to encourage them to come forward to report cases. This is really important because it was those opposition leaders that were at least complicit passively in allowing these rumours to spread that somehow Ebola was an invention of the government. So there's been a very important shift, and we'd want to thank those opposition leaders for coming forward and making those statements. We'd want to encourage them to make more of such statements. It should clearly be the case that the Ebola response should not be politicised and the Ebola response should not be caught up in people's disagreements with this particular government in Kinshasa. On the issue around the military-security relationship, the Honourable Member is absolutely right that we should only be using military personnel as a last resort. But it is a very, very difficult situation. There are nearly 200 separate insurgencies taking place in DRC. In particular, the ADF and the Mai Mai groups, which are operating in North Kivu and the surrounding areas, have, of course, as we've said, killed a doctor, mounted at least 2 attacks on Médecins Sans Frontières facilities, attacked up to 40 other health facilities. And therefore, with these kinds of problems, when we're protecting our health workers not just from the risk of getting Ebola itself, and of course health workers are amongst the individuals most at risk of contracting Ebola, but literally protecting them from being shot or attacked, it's understandable that in certain cases we have to work either with UN troops or the army of the DRC in order to address this outbreak. Finally, we need to be very, very realistic about what this whole situation means. So part of that is resilience, absolutely, investment in the public health facilities in DRC. But remember that the DRC government has dealt with 9 previous outbreaks. And in fact, Ebola is named after a river in DRC. It was first discovered because of an outbreak in DRC. So actually, the Congolese army and the DRC government has a huge amount of experience in dealing with this. Their failure to grip it here is specifically about the conflict in North Kivu, rather than them necessarily having the skills and experience to deal with it. And the final thing, Mr. Speaker, is that we need to invest in the resilience in the neighbouring countries. So to make sure, God forbid, were it to move into Uganda or Burundi or Rwanda, we have the proper response in place there to contain it immediately.
Latham.